Hello and welcome to From the Floor on our conference channel. Last year, as my team and I walked the exhibit floor at one of the fall conferences, I realized two things. Many health IT professionals could not make it to the conference because of travel restrictions or busy schedules, which is also true right now. And there are many excellent healthcare solutions who were at the conference and they were ready and willing to share their story about how they plan to help propel healthcare forward. We have short conversations with the vendors in their booths, and we ask them to tell us what problem they are trying to solve in healthcare and how they are going about doing that, and hopefully give you a taste of what it's like to walk from booth to booth. We'll try to capture as many of these as we can and share them with you. So we hope that you enjoy the new series. Special thanks to our sponsors on the conference channel, which are SureTest, CDW Healthcare, Artisight, and Rubric, for making this content possible and for investing in our mission to develop the next generation of health leaders. And now, from the floor.
Up first, we have a solution that brings relevant evidence-based content to the point of care.
All right, so tell me who you are and what is your role?
My name's Andrew Murray, and my role here at Zynx is that I help manage the relationship with various EHR vendors.
Wonderful. And Zynx Health, tell me, what is the solution you provide for healthcare?
So we provide evidence-based content that clinicians use at the point of care, and in the form of order sets, plans of care that span the entire continuum of the patient's health journey. And we also have tool sets that help keep that content current with all the guidelines and evidence that's available.
Wonderful. So what role at a health system would you like to have a conversation with, and what do you want to talk to them about?
So we love talking with people who are interested in performance improvement, clinical excellence, quality, CNIOs, CMIOs, medical director of IT, physician champions. We love talking to those kinds of people because they're passionate about what they do, just like us, and their mission is to how to operationalize this type of content at the point of care to really affect patient outcomes.
Wonderful. And last, are there any success stories or case studies that you'd like to share with our audience?
Sure. Well, one that we did recently was we worked on an automation project with a hospital in Indiana where we built an extraction off their EHR to essentially manage or keep their order sets current with all the evidence and guidelines, and we basically reduced the amount of time by 2 hours for each order set for them. So it was a big time savings, that's money. Yeah.
That's amazing. Well, thank you so much for your time today, Andrew. I really appreciate it.
Thank you, Holly. It was really great talking with you.
Awesome.
Up next, we have a medical interpreter solution.
Perfect. All right, so who are you and what is your role?
My name is Andrew Royce. I am the CEO of Voyce. And Voyce, we are a global leader in providing medical interpreter services. We believe that language should not be a barrier to your healthcare. And then when you enter the hallways of a hospital, the rooms of a hospital, you should have the ability to speak your own native language to your healthcare provider. In Voyce, we support over 7 million conversations a year in over 240 languages, including sign language for patients who are hearing impaired. And that's what we do.
Awesome. Who at a health system would you like to talk to, and what's the conversation you want to have with them?
Sure. Well, first of all, we love to talk to everyone. So if you're interested in providing more equitable access to healthcare at your organization, we'd love to talk with you. The type of folks that we typically talk to are Chief Information Officer, overseeing IT, Chief Executive Officer, Chief Nursing Officer, Chief Patient Experience Officer, Director of Language Access. Those are the types of folks we typically talk to, but we're open to talking to anyone if this is of interest to you.
Awesome. So just last, share any use cases or success stories with our audience.
Sure. Well, we were in a hospital called Vidant Health in Greenville, North Carolina. We had a husband and wife come in the hospital in the emergency room, and the wife was crying, and the healthcare providers couldn't figure out why she was so upset, as she was hearing impaired. So she didn't have the ability to communicate through spoken words. They brought out a voice medical interpreter on an iPad for American Sign Language. The interpreter interpreted to the patient, and they found out in the emergency room that this woman was going into labor. And they brought her in, she delivered a baby, and leveraged the interpreter through the whole process to communicate with their healthcare provider. That's just one of 7 million conversations we do a year, and it was a great success story.
That is wonderful. Well, thank you so much for your time.
Thank you as
we
well.
look forward to talking to you again.
Alex's lemonade stand was started by my daughter Alex in her front yard. By the time she was 4, she knew there was more that could be done. And she told us she was going to have a lemonade stand, and she wanted to give the money to her doctor so they could help kids like her. It was cute, right? She's going to cure cancer with a lemonade stand. Like only a 4-year-old would think that. But from day one, it just exceeded anything we could have imagined because people responded so generously to her.
We are working to give back and are excited to partner with Alex's Lemonade Stand this year. Having a child with cancer is one of the most painful and difficult situations a family can face. At Alex's Lemonade Stand Foundation, they understand the personal side of the diagnosis, the resources needed, and the impact that funded research can have for better treatments and more cures. You can get more information about them at alexslemonade.org. We are asking you to join us. You can hit our website. There's a banner at the top, and it says Alex's Lemonade Stand there. You can click on that and give money directly to the lemonade stand itself. Now, back to the show.
Third, we have an IT agility and efficiency solution.
All right, we're back at HIMSS 23. We're here at the Extreme Networks booth. And thanks so much for joining us. Tell me who you are and tell me what's your role here.
Hi, my name is Ryan Smith, and I'm the Director of Content Marketing here at Extreme Networks.
Love it. So tell me about the solution that you guys offer to healthcare.
Well, the solution that we bring to healthcare really is across the board. When we recently did a survey with HIMSS, a research survey, to discover what the organizational challenges that a lot of healthcare organizations were facing. And what we found were that they're facing clinical staffing issues, financial and inflationary challenges, and cybersecurity issues. And so when we dug a little bit deeper, what we found is that there's also an IT staffing issue that's creating a lot of friction in their ability to address those problems. So the solutions that Extreme Networks brings to the table really helps address IT efficiency and agility, but also gives them the platform that they need to be able to secure the network and secure the applications and devices that are connecting to the network, but also accelerate the projects that they need to be able to use to be able to increase clinical productivity in the face of staffing shortages.
Yeah, no, that's so great. So talk to me about who is it at the healthcare system that you want to talk to, and then what's the conversation you're looking to have with them?
Well, the people that we really want to talk to are IT leaders and decision makers. We want to talk to CIOs, we want to talk to CISOs, and even some of the people who are on the clinical side to be able to talk to them about the ways that the network can do more for them, the ways that the network can bring in automation and other types of AI and ML to help them automate the processes that are creating the friction, that's delaying the projects, that's delaying response times, and creating longer and longer times for routine tasks.
Right.
By addressing those, now you've got a more agile IT staff, and they can now get to those bigger projects. They can now get to those types of things that the organization, the business needs to be able to increase that clinical productivity. So for us, that's things like Fabric. When we start thinking about how Fabric is a technology that can increase the security posture of an organization, that's something that we can do, but it also creates opportunities for automation. It also creates opportunities to let less skilled, more junior IT staff do more of those types of projects, those routine tasks, and save your more experienced people for the more technical and more difficult tasks.
Yeah, that's awesome. So give me some success stories. Like, what are you seeing out there that you guys are proud of right now?
Well, you know, when we're talking about success stories, the healthcare organizations that we work with, we talk about OSF, we talk about Novant, Concord. All of those are success stories around organizations who have re-looked at the architecture of their network, who have modernized their network and began implementing these types of technologies like Fabric to begin to build in that automation. But that's not only where it stops, because one of the things that you'll find, especially here at HIMSS 23, is you'll find so many devices that are using the wireless network. So how does the wireless network and management of that network begin to play into the delivery chain for healthcare? So things like Wi-Fi 6 and being able to bring Wi-Fi 6 and 6E, the 6 gigahertz spectrum, into the hospital to get those real-time, low latency type of applications that have to be up. So how do we use the fabric, the Wi-Fi, and then management tools like cloud management that's powered by AI to give them the decision support systems to make all of that easier. So we bring in all of those things together to help hospitals address their IT staffing issues, that gives them that agility that eventually allows them the ability to provide the applications and the devices that their clinicians need to deliver care in the most efficient way possible.
I love it, man. Well, thank you so much for sharing a little bit of your heart and passion for this place.
I love it.
And thanks for all you do.
Thank you so much. All right, bye-bye.
Up next, we have a dedicated healthcare CRM solution.
So we're here at Salesforce. So talk to me a little bit about who you are and what's your role here with Salesforce.
Yeah, I'm the GM for Health and Life Sciences here at Salesforce. I've been at 8+ years, and my responsibility is the products and go-to-market for health solutions that we bring to market.
I love that. So talk to me a little bit about your solution. What's the solution that you guys offer to healthcare?
Yeah, we have a dedicated product called Health Cloud for healthcare and life sciences customers. It serves what we call as 5 segments of health. It is providers, payers, pharma companies, medtech, and also public health.
Wow.
And so what we bring is the power of CRM, which is our relationships, to deliver key applications and scenarios to our customers, whether you like patient services in the pharma space, to appointment management for providers, care management for payers, home health, or for public health, what we launch as emergency response during COVID times, like the vaccine management, contact tracing. So all that is part of our core Health Cloud offering.
I love that. So who at the healthcare system do you want to talk to, and what does that conversation look like?
So we want to talk all healthcare systems in that 5 areas that I mentioned, like from medtech, pharma, provider, payer, and public health. And I think the important message that we want to give to them is that the idea that health happens everywhere. It's not about just that 4 walls of the hospital.
That's right.
And it's also about holistic personal. So it is don't work only on the clinical side. 80% of health outcomes are determined by non-clinical factors. So make that choice, understand the relationship. The caregivers are also involved, whether it's the family members, the households. Look at all the silos that happen in health and bring them together. And that's what our message is, to focus on the holistic human, not just the clinical part.
That's powerful. Yeah. So talk to me a little bit about some success stories or some outcomes that have been happening.
Yeah. We have great customers of ours, and we are thankful to them. We have Humana as an example as a customer of ours. We have Mimit Health, Village MD, or we have Piedmont and Arkansas Health. They are all taking our CRM products. They are delivering care either as a health plan, they're doing care management, or they're doing primary care, which are doing patient assessments, or they're doing patient services like Novartis as a pharma customer in their life. And they all have amazing experiences about improving the outcomes of health, reducing the time to provide care, and automating those business processes. And meanwhile, making sure they have longitudinal, trusted relationship with the human. That's the most important thing.
That's right. Yeah. So, well, man, thank you so much for spending some time with us and giving us a little look inside Salesforce. We appreciate it.
Thanks a lot. Really appreciate it.
Up last, we have a large interoperability network to better inform care.
We're excited to be here at the Surescripts booth at HIMSS 2023. So talk to me tell me your name, tell me what your role is here at Surescripts.
Yeah, I'm Andrew Mellin. I'm the Chief Medical Information Officer at Surescripts, and my job is to bring that physician voice that the physician needs to everything we do here.
I love that. Yeah, so talk to me about the solution that you guys are bringing to healthcare these days.
Sure, so Surescripts is the nation's leading interoperability network. People know us about e-prescribing, but we do much more. Last year we moved over 21 billion sets of clinical information, pharmacy information, payer information through our network to better inform care for everyone who uses it. Our network consists of providers, health systems, pharmacies, specialty pharmacies, payers, PBMs. Really, we connect almost everyone in the country.
I love that. So when you're thinking about the healthcare system, who do you want to speak to in the system there, and what's the conversation that you'd like to have?
Yeah, so we are connected to pretty much every health system in the country already. We are talking to them all the time, both from the EHR operational team to the clinical leadership team. We're talking about patient safety, we're talking about They're e-prescribing. We're talking about how to inform the prescribers about how to make better choices for the patients, aligned with the patient's benefits design. So we're already talking to people in the health systems all the time.
Yeah, that's beautiful. So brag on Surescripts a little bit. Like, what's some success stories that you're having right now? What are you proud of? Some data behind that.
We just published our National Progress Report, which is our data from 2022.
Yeah.
A couple things I'd love to share. One is around our real-time prescription benefit. What that does is it brings to that provider at the time of prescribing the patient's out-of-pocket costs and lower cost alternatives. We saw an average of $61 of savings when providers made switches based on the information they saw. And over 600,000 prescribers are using that tool today, are enabled for that tool today. So we're really excited about that. The second thing we're focused on right now is specialty medications. We know that these are incredible medications that help patients with life-changing care, and we're using our tools to help remove those friction and burdens getting those patients started. So one of our large specialty pharmacies we work with, we've cut 2 days off the time it takes for them to get the patient started on this. So we're excited about that.
I love it.
And the third thing, one of our big announcements here is we announced our intent to apply to be a food bank, so under TEFCA. And so that interoperability framework is really the foundation of everything we do. We're using it to, now we're looking at ways to take interoperability to community pharmacies, help them be part of the care team. We're looking at ways to help inform that clinical care process, to help all the providers have the information they need. So we're just excited. We've grown tremendously. Last year, over a billion sets of clinical information were shared between providers to help inform patient care through our record locator exchange product. So again, it's not just e-prescribing, it's about interoperability for the country.
That's right. Lots to be excited about. Thank you so much for sharing those things with us and for spending a little bit of time with us. We're thankful for what you do.
Thank you very much.
Yeah, you got it.
What a great group of healthcare partners. We want to thank them for spending time with us from the floor and sharing their solutions and their aspirations for supporting healthcare IT. I want to thank them for talking with me, with Holly, and our team from the floor. We also want to thank our sponsors who make this content possible and are investing in our mission to develop the next generation of health leaders. They are SureTest, CDW Healthcare, Artisight, and Rubrik. Thanks for listening. That's all for now.